Good evening, everyone. I am Dr. Nirav Bhalani, interventional cardiologist and director, Rhythm Heart Institute and Rhythm Group of Hospitals, Vadodara, Dahod, and Banswara. I welcome you all to this live session. Today, the topic is very interesting, and yes, there are lots of myths considering this topic. So, let us break these myths with some facts. So, the topic would be myths and facts. What should be the lifestyle changes that is advised and post a bypass surgery or post a angioplasty, that is in a cardiac patient who has undergone some form of intervention in the form of stent or bypass. What are the lifestyle changes that he or she need to follow over a period of next 5 to 10 years? So first of all, what we have to understand is कोरोनरी आर्टरी डिजीज यानी हार्ट की नली का जो ब्लॉकेज है या ब्लॉकेजेस इन द आर्टरीज, they are lifestyle disorders. They are not like infective acute disorders. For example, if someone has a typhoid, 5 to 6 days of course, and that is over and you don't need to do anything. But blood pressure, diabetes, coronary artery disease, heart attack, ये सारे lifestyle disorder है. So even if you undergo a procedure to treat them, for example angioplasty or bypass, it is not a permanent solution. It is just fixing the problem at that time, and then over a period of years it should not again develop. For that we need to continue with lifestyle changes, and therefore the importance of lifestyle changes in a patient who has undergone coronary artery bypass surgery or coronary artery angioplasty, that is important, right? So the program starts in our hospital. How it starts in our hospital? The program starts right before the patient is discharged. So when a patient is discharged, my dietitian, my physiotherapist, and my counselors, they all go and meet the patient and the relative, the near and dear first degree relative, be it wife, mother, brother, and he's explained. Of course, at the same time, we take proper attention that we don't frighten the patient. We don't want him to be discouraged. We explain the patient that now you are starting a new life altogether, and we should follow healthy habits so that this new arteries that have been done by angioplasty or by bypass should not get blocked over a period of next 5, 7, 8 years. So emphasis is put upon lifelong healthy lifestyle habits. Post discharge, we are very clear that the heart is in a recovery mode. So we don't want them to aggressively start exercising. They need to have a cooling off period of at least 3 to 4 weeks because the heart is recovering. So during those 3 to 4 weeks, they can do mild exercises, they can do mild yogasanas, but nothing aggressive. I don't want them to walk 15 kilometers, 10 kilometers. I don't want them to run, jog. It is a gradual process and we are in no hurry. And my expert team of rehabilitative medicine would handhold them throughout their journey in cardiac rehabilitation. So the message is loud and clear that for the first 3 to 4 weeks, the heart is recovering, and therefore no undue exercise. At the same time, you don't need to be bedridden. You can do your day-to-day activities, do a 5 minute, 10 minute of walk and some breathing exercises, but nothing significant. Then comes the phase after 1 month when we see them in follow-up. Then comes the phase of starting your exercise schedule. So there they are advised to undergo certain exercises like cycling, jogging, swimming, walking, whatever they are comfortable with, whatever they like, and whatever is their hobby. The ideal the ideal way to exercise or ideal duration of exercise would be 35 to 40 minutes per day, and it should be at least 5 to 6 out of the 7 days in a week. So continuity is also important. So 35 to 40 minutes per day, at least 5 to 6 times in a week. And if you see how do you do how we do on a treadmill, like first 4 to 5 minutes is warm up, wherein you are activating your body, you are stretching your muscles, and it has to be a slow casual walk or a slow casual jog kind of a thing, first 4 to 5 minutes. Then comes the phase wherein for 15-20 minutes, depending on your capacity, it has to be a brisk walk. In a layman's language, we say something faster than casual walk and something less than a running. दौड़ने से कम चलने से ज्यादा, a brisk walk wherein you are moving your hands, wherein you perspire. Actually, this is the period which helps you burn your calories, which helps you control your diabetes, which helps you control your blood pressure, which helps you control your cholesterol levels. And then again for 4 to 5 minutes it will be a cool down phase. Again for 4 to 5 minutes it will be a cool down phase. Depending on your capacity, you should increase your phase of the brisk from 10 minutes to 15 minutes to 25 minutes, and try to reach a target of 40-45 minutes per day. So this is how you exercise. Along with exercise, it is very important to take a balanced diet. It is very important to avoid certain substances, especially oils, tobacco in any form like oral or smoking, and alcohol. You should go to greens, that is, you should take lot of green leafy vegetables, you should take bowls of salads, you should take bowls of fruits. Sometimes you can make a soup, sometimes you can make a juice. Almond and walnut are also very good. Cashew in moderation. So these are some of the changes that we normally ask our patients to do. And we understand that it is not very easy to stick to them on a regular basis, especially if you have never exercised in your life. So every 15 days, 1 month, we try to reassess how is your progress and how religiously you are doing it. If you have some issues, if you have some problems, we try to speak it out with the patients, the relatives. It can be a problem with the timing, it can be a problem with because of a knee joint. So we try to adjust their exercises accordingly. For example, if you have a knee issue and you're not able to walk fast or you are not able to jog, then swimming is a very good exercise. And believe you me, many people with knee joint problems do good with swimming for the knee pain also. You are trying to do it for a cardiac workup, but for the knee joints also it is useful. So cardiac rehabilitation is very important, and it is a slow phase. It is like you are going to do it slowly, and once you are habituated, you believe you me, you will be so happy and you will not be able to miss a single day without exercising. And that is what your lifelong lifestyle modification for cardiac patient would mean. Most of the time during our first follow up, the question is when can they go back to routine. So again, it is upon depending upon the ejection fraction or how badly damaged your heart was. What is the pumping fraction of the heart? If the heart is very weak, then you may take some time to get back to your routine activities. But majority of the patients in whom the ejection fraction is not heavily damaged or heart is not heavily damaged can resume or their day-to-day activities within 3 weeks. It is within this 3 weeks that they are as good to go back to the normal activities as before. So yeah, that is the another thing. Then there is something known as medical rehabilitation. So once a patient is absolutely symptom free, then he would start believing that he does not require any drugs. He is all good. So many patients try to stop the drugs and see, but that is very hazardous. You have to understand that decision for medical therapy should be guided by a qualified doctor, be it your general physician, be it your family physician, or be it your cardiologist. Only and only in consultant with a qualified doctor do make some changes in your medication as and when required. Again, post angiography, angioplasty, and post bypass, you need to take certain drugs for at least 6 months to 1 year. Post 1 year, most of the drugs will go down and you will be on bare minimum drugs. But believe you me, some drugs would be lifelong. You have to understand that this is not a disease, it is a lifestyle disorder. It is a lifestyle disorder. Your genetic makeup will not change, your tendency to form clots will not change. Overall, it is like you have a tendency to form more thick blood, and therefore certain blood thinning medications, certain other medications would be lifelong. And do not disregard your doctor's advice. Otherwise, we have seen many people defaulting on their drugs. We have seen many people stopping the drugs and landing up with trouble. And again, you have to start from square one, wherein again you have to undergo an angioplasty and you are back to square one. So, saying that, so cardiac rehabilitation is again, as I said, divided into the early phase, the middle phase, and the late phase. The predominant parts of a cardiac rehabilitation would be exercise and diet, and some psychotherapy. We need to counsel the relatives, the friends, and don't make them feel low, because there is a tendency कि अरे यार इसको तो हार्ट का प्रॉब्लम है, now he is weak and stuff. No, believe you me, every year before the corona, when this Vadodara marathon used to take place, Rhythm used to have 20 of our patients, minimum 20 of our patients who would complete the half marathon, who will complete the half marathon. They have either undergone angioplasty or a bypass surgery. So if your heart is not weak, if your heart is not heavily damaged, and you have undergone a timely angioplasty or a bypass surgery, and you have taken a proper cardiac rehabilitative course, believe you me, you can have the stamina to run a half the marathon. You can have the power and the ability to run half the marathon. So cardiac rehabilitation is important, and you should not feel that, oh my god, I am a heart patient, I'll not be able to do. It is all in the head, and with some social support, with some mental grit, you can be back to normal, in fact better, because now your heart is getting more blood, and therefore it will be able to give more blood to your other organs, to your muscles, to your brain, everywhere. And therefore I don't see any reason why a patient who has undergone a CABG or a angioplasty should be feeling weak about himself, is if he has undergone a proper cardiac rehabilitative program. So believe in yourself, believe in the power of healing of God, and believe in your doctor. And cardiac rehabilitation definitely will put you back on the track, and you are inferior to no other person of your age or your friends or your family members. With this, I think I would take some questions if anyone has any. So there's a question like, what is better, exercise or yoga for heart patient? So as I said, depending on your capacity, depending on your health status, depending on your age, exercise in any form, either it be a traditional yoga, or it be aerobics, or it be isotonic exercises, 30 to 35 minutes of exercise is good for heart patients. Depending on what you like, what is your hobby, you should be able to continue it for long. You should be able to do good repetitions of the same, and then any either yoga or exercise, both are good. Can exercise repair heart damage? Definitely. There is something known as neurorevascularization, wherein small collaterals develop whenever the heart is given some challenge. So exercise can definitely help repair heart. But as I said, it has to be a gradual process. You do not want magic overnight. It has to be a gradual process. Slow and steady wins the race. You should not overexert. Otherwise, it will damage the heart rather than repairing it. How often do we need to do a lipid profile pathology test after the age of 40? So again, there are no clear cut guidelines, but depending on how overall risk factor profile is, for example, if someone has a strong positive family history of heart attacks, if the patient himself is diabetic, if the patient has some symptoms, then I would suggest a 2 yearly lipid profile. And depending on that, depending on the results, if once it is normal, if the lipid profile is abnormal, you will be started on drugs, and then you might have to check it at the 3 or 6 monthly interval. And once the lipid profile has reached a normal value on either on diet or exercise, or on a particular dosage of drug, then you can repeat it every yearly or 2 yearly. Alcohol again is a very tricky question, because uh, alcohol in very small quantity is good for heart, especially red wine. And but what I understand is that small quantity is does not give you that kick or the pleasure. And therefore, if you're not an alcoholic, I would not, if you're not taking alcohol regularly, I would not advise alcohol as a medicine, or I would not advise alcohol as a good for heart thing. But yeah, if you have a habit of taking alcohol, I would say 1 to 2 packs, 1 to 2 days a week, 30 ml is what is the recommended unit. And red wine is always better than any other form of alcohol. As I said once, depending on the damage, as I said, that depending on the damage, depending on the ejection fraction of the heart, if the heart is very weak, the returning to the office may take 2 to 3 months. But in majority of the patient, if the timely procedure of an angioplasty is done, most of the patients can get back to their routine work within 3 to 4 week period under the guidance of a cardiologist. No, oil is important for many other mechanisms, many other reactions in our body. Therefore, oil total no is not a solution. In moderation, the oil should be in moderation. 1 to 2 teaspoon in a day should be okay. And sunflower oil or corn oil or rice bran oil, these are the better oils compared to some other oils. Olive is the best, but it is more of a salad oil. So, but yeah, zero oil you may not go to. You may go to cut down in the quantity of the oil. See, depending on the indication, what are the symptoms? If you are absolutely asymptomatic, my suggestion would be to go for a stress test. At the age of 40, you should get your first stress test done, and then every 5 years you should repeat one stress test. But if you are diabetic, every 3 years. So stress test, wherein you stress your heart to understand everything is okay or not. So asymptomatic patient should undergo a first stress test at the age of 40, and then repeat it every 3 or 5 yearly, depending on whether he is diabetic or not. So total cholesterol is a type of cholesterol. There are different types of cholesterol. There is HDL, which is the good cholesterol, and then there is a triglyceride, total cholesterol, and LDL, which are the bad cholesterol. So some are genetic factors, some are dietary factors, some are obesity, some are diabetic. So a lot of reasons wherein the cholesterol, sedentary lifestyle, a lot of reasons wherein the cholesterol levels can go up. And most way important, the best way to cut down is diet, exercise, and if not control with diet and exercise, you may have to take certain drugs, and these drugs go by the name of statins. So cardiac rehabilitation is what we discussed in our lecture. Cardiac rehabilitation, as the name suggests, is rehabilitating a damaged heart. So any patient who has undergone a cardiac procedure, be it angiography, angioplasty, or a bypass surgery, would then gradually shift back to living a normal life, and the physiotherapists, the dietitian, the doctors who guide them are a part of the cardiac rehabilitation team, and the way they do the process is known as cardiac rehabilitation. LVF 60% means that your ejection fraction is 60%, which is normal. Anything more than 50% is good. Anything more than 40% is okay. Anything less than 40% is that your heart has significant damage. So 60% is a normal ejection fraction. Thank you. So I think with this, majority of the questions are answered to. Looking forward to see you again. Thank you.